Senator from Montana.
Thank you, Mr. President. Mr. President, I rise today on behalf of 152,000 of my constituents in Montana with pre-existing conditions. These are folks that are struggling with things like diabetes and heart disease and asthma and cancer. Many of them are just one medical bill away from bankruptcy. Thankfully, their health insurance is there for them when they need it, whether it be a joint replacement or chemo or having a baby. Federal law holds health insurance companies accountable to guarantee that their plans cover us when we need it. Unfortunately, those rules are being tossed out so that big insurance can make a quick buck at the expense of working families. Just last week, health insurance companies started flooding the market with junk plans. These plans are marketed as cheap insurance that will keep you healthy. $50 a month for full coverage, they say. $8.95 a week for top-rated coverage, they claim. Now, that's a heck of a deal. Well, not so fast. They're total and complete shams. If you read the fine print, you will discover that dialysis, blood pressure pills, x-rays aren't covered. In fact, most things aren't covered. Originally, insurance companies designed these plans to provide stopgap coverage when you change jobs and needed health care for just a few months. They figured you could get by with a bare-bones policy for a month or two. They were never designed to provide coverage for an entire year, let alone 3. But now that has all changed. Starting last week, health insurance companies now have permission to sell long-term junk plans to Montana's families. What was once a short-term solution is now becoming a long-term problem. So let's ask ourselves why we buy insurance in the first place. It's for risk management. Why do I buy auto insurance? It's in case you get in an auto wreck. Hope you never have to use it. But if you do, you need that insurance to take care of that automobile to get it back on the road again. Why do you buy fire insurance? In case you have a fire. Hope it never, ever happens, but every once in a while it does. And if you are unfortunate, it happens to you, you have fire insurance to rebuild your home. I'm a farmer. Why do you have crop insurance? Well, you have crop insurance in that case where Mother Nature may not be smiling upon you, you may not get the rain at the appropriate time, or you may get a hailstorm that wipes you out. You hope it never happens, but if it does, you've got that crop insurance you can depend upon to manage your risk. So why do you buy health insurance? Is it because you plan on getting sick? I don't think so. It's because if you get sick, you'll need the coverage. If you end up with high blood pressure, you have the coverage to help offset those costs. Unfortunately, with these junk plans, they're called junk for a reason, because they don't cover anything. They give you a false sense of hope and a false sense of coverage, and you have no coverage. I want to take you back to 1965. In 1965, my parents bought an accident insurance policy that was supposed to cover accidents. And guess what happened? In 1965, I got in a little accident with a meat grinder. And that insurance policy covered nothing. My folks had to dig deep and pay for the costs. When they thought they had insurance, they had nothing. I was young, but I can still remember how angry my father was that they had been sold a bill of goods. And that's exactly what it is with these junk insurance plans. Montanans are getting grifted. They're being sold a bill of goods. They're being lied to, deceived, and I will do whatever I can do to keep the junk out of our health care. We must hold big insurance companies accountable. We cannot let corporations swindle folks who need health insurance when in the end they have nothing. The bill before us does that. It keeps short-term plans short-term. It stops insurance companies from selling garbage plans that don't cover pre-existing conditions. And that's why I'm urging my colleagues to vote for this resolution to stand up for Montanans across the state and Americans across this country. These are folks who work hard to put food on the table, and they shouldn't have to choose between a doctor's appointment and a utility bill. Today I rise for those folks from Miles City to Harleton to Libby and promise to defend them from these shoddy plans. With that, Mr. President, I yield the floor. I suggest the
Clerk, call the roll.